This story is part of a larger mosaic of stories on post-acute sequelae of COVID-19, PASC, also known as long COVID. Read part 1 of this series on loss of smell after COVID-19. SARS-CoV-2 infection can damage many organs other than the lungs. The most troubling is damage to the brain. A series of recent studies document long-term brain damage in as many as 1/4 of all those infected regardless of the severity of the initial disease. Those numbers are daunting considering that an estimated 140 million Americans have been infected by SARS-CoV-2. Symptoms, such as brain fog, fatigue, depression and a host of other maladies, may be mild or incapacitating. Several studies warn that treatment of those with long-term brain injury will strain the healthcare system for years to come. Understanding the origin and treatment of COVID-19-related brain injury is a high priority for medical science. A recent study by Frontera et al. Of the NYU Grossman School of Medicine evaluated the cognitive function of COVID-19 patients 6 months after they were hospitalized for COVID-19. To their surprise, over 90% of their total cohort reported at least one neurological symptom. Among those that had not experienced neurological complications while hospitalized, 88% reported new cognitive symptoms. These cognitive impairments seem to be separate and apart from damage due to hypoxia, or the lack of oxygen to the brain, often experienced by those hospitalized for severe COVID-19. Reportedly, some individuals that recover from mild or asymptomatic infection may later develop complications that are not immediately apparent. The table below lists commonly reported neurological symptoms by previously hospitalized COVID-19 patients. Through in-person screenings, a team of neurologists diagnosed more than half of those who participated in the NYU study with encephalopathy. Encephalopathy broadly refers to damage or disease that alters the brain structure or function. Those diagnosed with encephalopathy had a higher than expected incidence of strokes and seizures. Another 21% had symptoms related to oxygen starvation related to COVID-19 damage to the lung and in some cases to the heart. Frontera et al. Found significant correlations between the prevalence of neurological complications and an inability to return to daily activity, even 6 months after the initial infection. Those that developed neurological complications while hospitalized for COVID-19, in particular, were twice as likely to perform worse on cognitive assessments, compared to individuals not diagnosed during hospitalization. For instance, over 50% reported being unable to return to daily activities and 59% of those that were previously employed are now not able to return to work.